So, welcome to PNR204. This is pediatric nursing. My name is Professor Bogart, and you all just heard me talking. Yes, I have been involved with Fortis for a while. Joined them in 2017, starting on the RN side, teaching pharmacology, pediatrics, and I did some community, and I also assisted with med surge. I'm one of those nurses who did adults and children. So I've got a very broad knowledge. And you'll see me saying, this could be kids, but it's also adults. And that will help you understand things a lot more, I think, when you hear those things. How do I teach? Well, I do have a PowerPoint. I don't read it. What I'll do is go over some key concepts on those PowerPoints. I'm going to tell you little stories, little things that's happened to me with my patients, my kids, how I responded to them. And I think if you get that little personal, experience, it helps you understand things a lot better. Now, what I want from you is to be able to say, hey, I don't get it. I don't understand it because I will stop. I don't get offended. It doesn't bother me. In fact, I tell you, please stop me when you don't know. And I'm sure somebody else doesn't know the same, doesn't understand what's going on, and it's going to help somebody else. So don't be afraid to stop me. So I teach with the PowerPoint, as I said, but then if I have time, sometimes I do, sometimes I don't, depending. I'll send you a Kahoots. Now, these Kahoots are very important. These are going to be testing your knowledge of the day. These Kahoots are going to be showing you exam questions. It's going to be showing you quiz questions and SC questions. So you're getting everything all at once. Now, Ricardo, you came in on an iPhone. Can you tell me your last name? Because
My
we need to have your real last name.
Hi, good afternoon, Professor. My name is Ricardo Archer. I'm not sure why
Archer.
it is showing. I'm actually on my computer, so I'm not sure why it's showing on an iPhone.
It says Ricardo's iPhone 2.
Yeah, let me see if I can update that. But I'm actually on my
Anyway,
computer.
there you are. I just did it, but you'll have to update it so next time you don't come in the same way. Now, why do I do that? Now, I explained it to some that were already here. When they look at attendance, accrediting bodies come in, do open Zoom logs, and do make sure that your attendance is filed correctly. And if you don't have your name as known by Fortis, they're going to say, no, they don't have attendance. And it could, hurt with our accreditation. And we don't want anything like that to happen. So I will watch over you. I'm going to help you. I'm going to guide you. I'm going to hold your hand because my goal is everybody pass, everybody succeed. Now, how is that going to happen? Well, when you don't understand, you ask questions. That's number one. And if you need extra help, ask. I am here to tutor with you 1-to-1, 3-to-1, with your buddies in them, doesn't matter. Going over what you need to understand better, okay? Now, I've asked some of you, please put your name and your campus in the chat box because I don't have the listings of who's in what campus right now. So this will help guide me in case I have any questions at all. So you've got PowerPoints and Kahoots I do every single week. All right. Now, exams. I do have quizzes. Your first quiz is next week. It's on this week's material. And that week one handout that you got, study it. That's what's going to be on the quiz. Okay? Very easy. Exams. We will be doing exam reviews. All the pediatric professors do a review. You will get all of the recordings posted. And I put it in one announcement. I just keep editing that one announcement so it's in one place. I mean, many of you are in 3 courses and some are in 4, and I know that. So I'm trying to keep you organized so that you can find things easier. There are 1, 2, 3, 4, 5, 6 different professors. Would you like 6 announcements with 6 different recordings? No, I put it in one place. Now, when I do your announcements weekly, it's going to give you 2 that will be there every week. The first one, well, you got the welcome PNR 204 one. which shows you the information for the week also. It has your PowerPoint, it has your handout, it has anything that's important for you. Now, later on tonight or first thing in the morning, you'll be getting a recording from me from this meeting. In that recording, you're also going to have a cahoots. Whether I get to it or not, I probably will, but just in case things happen. So you'll get the recording. I'll repost the PowerPoint with it. I'll repost your week 1 handout that you need to know for next week for your quiz. So one place, 2 announcements every week. Now, if you see another announcement from me, it's important. I do not send out 10 announcements a week. You're not going to read them. You have too much to think about. But if you know 2's coming, uh-oh, there's another one, I better pay attention. Okay? So that's just me telling you who I am. Your time is busy. I get it. I went back to school and an associate degree forever. I've been a nurse forever, almost 50 years, I think. I don't know, long time, since 1976, believe it or not. And I was not a PN, I wasn't a nurse aide, nothing. I went into nursing school, I didn't even know what an enema meant or what a urinal was. So I went in blinded and I graduated by age 20. So I've been a nurse for 46, 47 years now, a long time. Got a lot of experience. Adult, I've got children, I've got ER, I've got recovery, I've done all specialties, I've done management, I've been all over the place. So, but the last 25 years, I was at Nicholas Children's Hospital, a big hospital down here, and I worked the newborn ICU, the cardiac ICU, and the last 10 years was in the emergency room. I'm a trauma junkie. I'm the person that when your child comes in sick, you want me there watching them as the primary nurse. And I really enjoyed my time there. So today, what are we going to do? We're going to do your orientation PowerPoint. If you have another online, you've seen it before. I'm going to go over it and hit those key points that you need to know that I expect from you, okay? Any questions, go back, refer to it. The second thing is I'm going to go over this week's information, which is chapters 15 through 17, and then I will try to get to the cahoots. And basically, that's an instant testing on the information I just taught. I know that twice in one night you're seeing the same thing. You're going to remember a lot more. And if you come to class at least looking at this week's information, you've seen it once, I teach it once, I then test you with a cahoots, guess what? You're going to remember a lot more, okay? So, any questions? All right, let's go ahead and let's just start with our orientation. Tell me, this is from Dr. Brown. A lot of information she wanted me to have here, and this is what I do. So we know online is difficult. Make sure you have a good internet, that you have a good charge. I know many times I got to go get a plug or I need to charge my phone, or make sure things are charged before you come to class, or you have the chargers with you, okay? First of all, if you have a problem and you need to get a hold of me, um, I have a couple different ways. Now, I'm always looking at my emails and looking at my messages from Canvas, making sure that as soon as you're asking me questions, I can respond to you. Let's say you can't wait that 5 minutes, that 1 hour. You may call me or text me if you're having a moment. And my phone number is listed. It's in the modules under Professor Bogart. But also, let me give it to you now. My cell phone, 305 951 8055. That's for those emergent, I need to get a hold of you now. If you can wait a little bit, send a message or send an email to me. All the information is in the modules on how to get a hold of me. The
Professor,
whole semester.
that
Go
one
ahead.
more time. I'm sorry. Can you say that one more time?
Oh,
What's your
sure.
number? 305.
305 951 8055. And I always have my phone with me. Now, sometimes my grandson steals it, I will admit, but usually he'll tell me if I'm getting some messages or stuff, usually, okay? But I check the messages pretty frequently. Now, I'm not the lead of PN, and it is Professor Stiles. So if you can't get a hold of me, please get a hold of Professor Stiles. She's very much like me, where she's always on the ball. She's always checking her messages, etc. Get a hold of her. Well, what if you're not getting hold of anybody and you need somebody now? Please, and I tell you, please get a hold of Dr. Brown. Dr. Brown, I'm not going to get in trouble. I'm not going to be upset with you that you reported me to my boss. No, because our goal in this program is for all of you to succeed. And if you need something and I'm not there or Professor Stiles isn't there to help you, she will help you or she'll make sure that I do quickly. Okay. So don't be afraid to get a hold of her. This is her information. It's on this PowerPoint. You can go back and look. I mean, one of the things about communicating is to do it with civility. That means no big capital letters because you're upset. I understand. I get upset too, but we need to be, courteous to each other. All right. Now, the first week, there is a discussion question and it is due by tonight. Now, I am pretty lenient the first week. As long as you get the discussion question and the two repeated responses by Sunday, I'm okay with it. Because I know people are moving classes. I've got this student moving here, one there. It's okay as long as it's done. And then, of course, do your introduction one. I want to know who you are. Tell me who you are. And I love reading those things. Now, there's always a question about discussion questions. Can you do the peer responses when you do your initial post? If there are enough responses there that you can look at one of them and do your two peer reposts, I don't mind that. Some professors are like, you do your discussion and then you wait, and the next day you do your replies. It's okay with me. You can do them all together as long as you're getting what you need from that discussion question. You'll be surprised how much of the discussion questions are on exams and on quizzes. So they are important. They're not just busy work. There's a lot of extra work that I can't get to every single thing that you need to know, okay? There has been in the past a lot of problems with what they call professional conduct, as in going to websites like where are they? Studocco, Course Hero, Stuvio, and there's more, and copying and pasting work, etc., and cheating. Now, I know that there are times that these things can happen, but let me tell you one thing. If you cheat or you copy, you're not going to be getting what you need from whatever that assignment was. And if you cheat, you're cheating yourself because in the end, you are sitting at that NCLEX, nobody else. So I would prefer you to get a C and just pass. You don't need to have an A to be a nurse, okay? Then to think that you need an A and there's cheating going on. So just think about that. I didn't graduate nursing school with an A GPA, okay? Now, my BSN, MSN, PhD, yes, they're all 4.0, of course, but it's a different thing. My nursing, I just made it by the skin of my teeth. All right. But I'm a really good nurse. So there's a thing that many of the nurses used to tell me where I was going back to their degrees, and they're like, C equals RN, or C equals PN. I'm like, C equals nurse. And I'm like, yes, just make sure, that you do what you need to do to pass. If you get the A, that's commendable. Some of you will, but some of you won't. And don't be upset. It doesn't make you less than. Okay. Now, homework. You have the discussion question. It's due by Sunday, midnight. It's not in. You will get one more week to turn it in, but with a 10% deduction. And that's NCLEX questions, CJ Sims, That's your, at the end of the program, you have your RN assignment and practice exams. If they're late, it's minus 10%. I would always, and your NCLEX questions. Remember that try to get it in on time and try to get at least the passing grade. Your homework grades are 20%. And if you don't do them up to that level and you're just making it by, your homework could fail you. And I had a homework fail last quarter. And that upsets me because, that's something that you have control on. Now, what if it's Sunday and you've been sick, or it's Saturday and you're not getting the NCLEX questions done or the CJ Sims done? Let me know. I'm sick. My daughter's sick. My mother, my this, my that. So I can give you extra time and I'll not deduct you as long as you tell me before things are due. Okay? Communicate with me. I will listen and I will help you, but I can't help if you don't tell me before. As I said, attendance at 1 minute after or 5:31, it is 15 minutes late. So try to be in there on time. When you're here, make sure your name is proper as known by Floridas. And you see me do two different, making sure that you all have that. Another thing with attendance, sometimes, things happen and you don't get to class. Make sure that number one, if you can't make class and you have an excuse and you have documentation of some sort, please give it to me and give it to me as soon as possible. Because if you get up to that 20%, you know what happens. You will go down a whole grade. And yes, they are enforcing that very closely. But let's say 2 times you're in the ER, or you were in the ER with yourself, an ER with your husband, your brother, your sister, your mother, whoever. Give me documentation, and that can explain why you weren't here, and you won't get that 20%. Okay? So be aware that documentation can help you. They will be sending the 5, the 10, the 15%, percentages out. So, you'll be aware of what you are. And if you want to know, ask me. I also can figure it out for you too. So, how do you succeed? Well, every week I send you an announcement with what assignments are due. Make sure they're done, right? Make sure you go back, for instance, NCLEX questions, CJ Sims. If they're not turned in correctly, and you turned in something and you see a 0, that means something wasn't right. And I'm going to explain to you what you need to do to make it correct. And I'll give you to that next Sunday to get it done. After that Sunday, it's still a 0. So make sure if you're seeing zeros where they shouldn't be, there's something there and I will help you with it. If you don't understand it, I can pop on Zoom for 2 minutes and help you through it. Okay? Just let me know. Again, just talk to me. Have your computer plugged in. Make sure that you know what assignments are due. The syllabus is the Bible. Whatever the syllabus says when things are due, that is when they are due. Now, I don't have quote what we call a tutoring session. I have what we call an open one. You need help, you email me, and I will get together on your time where I can to help you understand. Maybe it's the cardiac you don't understand, or maybe it's something about growth and development and the theorist or something. Let me know. I can help you. So send me a message and I will work with you. That's what that's all about, one-to-one tutoring, etc. So we know that we need to have a 80% on the key graded assignments. That's the KGA. That is your quizzes, your exams, and your HESI. Okay. Once we get that 80%, you got your 78, you're doing good. We add in the homework, which is all of the other stuff. Initially, homework grades are off, so you don't see how it affects your grade. But on week 6, I turn them on. And I keep them on up till week 8, and then I turn them off. I cannot turn them on until after all the remediation's done on the HESI, and that will be your final grade. I can't turn on just one student. I've had students ask me, it's all or nothing. So be aware of that. And I mean, if you're doing an assignment, at least get a passing grade on everything, okay? That's what I tell you. Please make sure you do. So quizzes and exam, make sure you come in. On quizzes, I don't do a double, visual. I'm going to do an overall look. I'm going to do a check on you, and we'll do the quiz. On exams, you must come in on another device. I'm going to do, checking your ears, your wrists. I'm going to be checking your environment, et cetera, and then we'll be going ahead with the exams, okay? If you are not on camera and you're doing a quiz or an exam, you're not on camera, I'm first going to try to say, hey, you got to get on camera. If you don't respond after, repeated tries, because I try really hard to get you, it will be a 0. So don't let that happen. Let me see. Exams are on ExamSoft. They've made it more easily readable now for your different computers and also for iPads, et cetera. So it is a little bit there was some computers that we couldn't get it before, but now they've worked really hard for that. Now, quizzes. If you're not here at the beginning of class, because I do them at the beginning of the class, and you're not here, no matter the excuse, you cannot make them up. Okay? So make sure that if you have to be sick or something else is going on, know that that quiz is not, you can't make it up. The only time, and I'm letting you know this, let's say you're that close to passing and you missed a quiz, Dr. Brown may let you make the quiz up. Not a guarantee, but I just want you to know that, okay? Exams are one attempt. Quizzes are one attempt. What happens if all of a sudden the internet goes out and your computer goes blank and whatever goes on? Number one, I need you to contact me immediately, okay? Just stop. Now, exams, we can get ExamSoft to pick it up where it stopped, okay? It doesn't get lost to the exam. So just say, hey, all of a sudden it could be up north, a snowstorm. Down here in south, it could be a thunderstorm or a good old FPL just all of a sudden just cuts off, or one of the companies, the internet stops working. Just let me know. So it's, you can't finish it, let me know. Text me, email me, whatever. Do it all to show, because I can see in quizzes and exams the time where you stopped, and I could correlate that to your email and the text messages to tell me this is what happened, okay? I can put it together for you. Now, if anybody has accommodations, I need to know as soon as possible. Your first quiz is next week, and I will give you extra time as long as I have accommodations for you, okay? Now, I need that letter from Dr. Elaine Foster that says accommodations, and it tells me what you get, okay? If you're a person who takes exams, we need to work on when are we giving you the exams, or you just coming in early to start them, because when exams are over, I give class. There's another hour that I can give a class and give the information for that week in, okay? So make sure I get that stuff as soon as you can. Now, sometimes some students like to take exams on campus, and that's okay. I don't mind it. It should be at the same time as class is going. Also, the person on campus who's going to be proctoring it, I need them to email me. I need to validate who they are before I give them an access code, all right? I've worked with many campuses doing it very flawlessly, seamlessly. It works well. If you're comfortable there, I have no problem with that at all. But that faculty has to notify me, and you need to tell me also. There's two things that have to happen, and it should be 72 hours before exams. So we know all about exams being proctor. Now, what happens if all of a sudden you end up and you're with a severe migraine, you can't open your eyes, or you're so sick you can't lift your head and you can't take an exam? What did I tell you about when you can't do something? Notify me before the exam, okay? And if you notify me, and then if you've got documentation, it's even better. Let me know what's going on, and I can reschedule a date and a time for you to retake your exam, okay? I mean, all exams, we can make up different exams for everybody. There is a test bank now. So your exam is not necessarily the one that your partners had, but it's something that I can give you the same information with a different type of question on the same concept. Okay. So exams, if you miss them and don't tell me, it's minus 10%, and you have 1 week to make it up, which means before next Wednesday, you would have to give me a time to get your exam given, okay? All you have is that 1 week. Again, before exams. We know that the quizzes are right through the modules. It still runs the same way. Again, if any problems, stop, let me know immediately. HESI exams. We've got, a few HESI things that we're doing to help you. Of course, there's going to be reviews before the HESI. Know that, HESIs, ideally, we would like them on the same day as class. I mean, that's what we would hope. But, it doesn't matter what I think, because I have no control over when HESIs are given. It's per campus, because it's based on when they have faculty and space available in order to give it to you. So you might be a Wednesday class, but you might get a Monday HESI. All right. That's what I'm trying to tell you. Remediation, you just went through it last quarter. It's the same. I will send you an announcement right before week 11 to let you know the hours and whatever you need. And if you're not getting it done, you'll be hearing from me just like you will for any assignments. I will let you know what's missing so that you can get it in so that you can get the most points you can. We know that during exams, you're going to need your ID or you're going to need your school ID, okay? Homework. Make sure, I mean, you're not really heavy in homework in this at all. You have NCLEX questions, you have CJ Sims, and you have what these call the HESI case studies in the end. So it's not heavy in homework. Just make sure that they're in by Sunday, 11:59 p.m. to get it, because you don't want to get that minus 10%. After 1 week late, I cannot accept anything. NCLEX questions. The first week is on growth and development. So do not go to Sounders and check pediatrics. It's growth and development, okay? If the first week you see a 0 in the box that you did your NCLEX questions and you see a 0, you're like, I did those. Well, was probably not the right area. So be careful. I don't want you to have to redo your work again, all right? Also, it must be turned in the proper format. That little green square, don't take a picture of that and send it to me. That's not right. You go down on that little green square to the bottom right corner, you print the results, but you don't print it, you save it. And that's what you upload into Canvas, okay? If you don't know how to do it, ask me. I also will be attaching an instruction sheet for you in case you need that, okay? Remember, NCLEX questions, you can do them as many times as you want, and try to get above a 78. That's what I'm telling you. Always try to get better than what you want. So that HESI assignment practice exam is through Evolve. It is through the course modules. We don't have that much problems as we did before, but sometimes they try to go through Evolve and get it done without going through the modules. You can't. When you go through the modules, you're going to see it, and it should, although occasionally there's a glitch and it doesn't. it should transfer over into the grade book. If it doesn't go into the grade book, send me a message. I can look, I can find it for you, okay? And if I can't, we'll put in a help desk ticket, okay? CJ Sims. Now, CJ Sims, I always get some weird printouts, weird screenshots. Make sure your name is in the right upper hand corner, the name of the scenario, the date and the time, and then, of course, your grade. All right. Again, you see a 0, there's a problem. Go look what I need and then go ahead and resubmit it. Okay. You don't have any paper assignments. You're lucky. We do have some, but that is most of, those rules and regulations. I think the one thing you need to take away from this is any problems, let me know before things are due and I can help you. If you wait till after, I can't. Okay? Any questions? Great. Those who came in late, just put your name and your campus in the chat box for me.
Yes, I do have a question. I'm sorry, Professor.
Sure, go ahead.
You said that although discussion 1 is due tonight and the replies aren't due to Sunday, if we turn everything in Sunday, we won't get points off.
Not this week,
I'm assuming.
yes.
Okay.
Not this week, not
Oh,
this week. And
all
I
right.
also said that if you're doing them, let's say on Tuesday, and you want to do the replies right then and there, you can. There's some
Okay.
teachers who don't let you.
Oh,
As
yeah.
long as you're getting the information from it that you need, that's what I'm looking at, okay?
Okay. All right. Thank you so much.
No, thank you. So you have a PowerPoint. I made mine a little darker. It's the same PowerPoint. On my eyes, this works easier for me. And it is attached to your announcements that I put up this week. So very much key terms. And if you have that week 1 handout that we gave you, a lot of this stuff you can fill in from the PowerPoint and some other stuff you're going to fill in from your book. Okay. Your book, very important when we look at quizzes and exams. So key terms in childhood development. So these are just things you have to know. It's a memory sort of thing. So development, it's the progressive increase in function of the body. Well, babies, they're born, they can't even lift their head, right? So the first development would be able to lift their head up. As simple as that. Cephalocaudal, cephalic, head, and caudal, feet. That means you lift your head first up, and by 1 year, you're on your feet and walking. Okay. Proximal distal. Well, it starts with everything here the baby sees can works with, and then all of a sudden, which is proximal, and then all of a sudden they can reach out and they see and can grab things voluntary from the outside periphery. Okay, that is proximal distal. We know growth is all about growing, height and weight. The one thing that we do in children is every single visit, doctor's office, urgent care, ERs, doesn't matter. We do a height and weight. Why do we do a height and weight every visit? Well, nutrition is the most important thing with children, and we measure it. Are you growing? Have you gained weight? Are you getting taller? And then the third thing is, are you developing the weight you should? Can you lift your head up by 4 months old? What if you can't? You're behind. What if you can't roll completely over by 6 months and it's now 9 months? Again, probably nutrition, you're not getting enough. So height and weight is growth. Very, very important. And then maturation is the total way in which a person grows and develops as dictated by inheritance. As in, if I'm tall, my kids will be tall. I'm short, my kids are going to be short. You're not going to be with a short parent and you're going to be 6 foot tall. It won't happen, right? That's basically what it says. Now, differences between children and adults. We know Adults have already reached their height and their weight, and all they can do is get skinnier or fatter, right? You're not going to grow anymore. Children are constantly growing. And I'm just going to give you bits and pieces of it. An infant born at 7 pounds, right? They can't lift their head. At 6 months, they're able to double their weight. So 7 pounds is now a 14-pound child, normal, okay? And by 6 months, they should be able to be turning over. By 1 year, a child, an infant, will be tripling or 21 pounds, and they're almost walking or are walking. So that is what we're talking about, differences between adults and children. And we know all of it don't happen at the same time. Kids are all different. Your son, your daughter, they could be one. I was walking at 6 months. Well, this one is 15 months and just started walking. They're both healthy as long as all the other stuff matches up. Okay. So, developmental needs, the one thing that you have a child who's sick, you need to know where their developmental is to be able to help them to understand what's going on with them. You try to explain to a toddler in terminology they don't understand or in a way that feels threatening, they're not going to listen, they're not going to learn, they're not going to understand. And it's the one thing that we want to know, okay? So children, I think one of the things that you can relate is children and the elderly are so much alike in many ways. The way their GI system works. The elderly has more problems. Children also takes a while for everything to mature. The liver, the kidneys in adults sometimes function slower. So do children. They're like very, very close, children and the adults here. Now, the nursing process, growth development. So, the data collection. I think the first thing that we do is we look at height and weight. Are they where they should be, right? I've already said this. And then their developmental milestones. They're rolling over at 6 months. Wow, they're right on key. At 8 months, they're sitting up unsupported. That's what you want to see, okay? And then we're just going to look at the child, the way that they are, looking at the world and playing with toys, the way they grasp things, their fine motor developments, right? And then a nursing diagnosis. You know, there is many ways to put nursing diagnoses. It could be, child is under child unable to turn completely old, child behind in developmental levels, as evidenced by unable to turn over because of low weight, right? Nutrition, we're saying something about nutrition. Then, of course, you're going to plan. So this is your ad pie. We're going to plan. What are we going to do to help that? Well, we're going to make sure nutrition is better. We're going to make sure maybe they need physical therapy. Maybe, they can't lift their head because they're weak due to some neuromuscular disease we don't know about yet. Implementation is literally figuring out how we're going to help the parent and the child in a manner that they both can work with. And then after we've done all of this, we've given physical therapy, we've given good nutrition. Now let's evaluate. Their weight is good. Now they've caught up. This 1 year old and they're walking, they're talking. Now we know evaluation, what we did was right. There is CJ Sims, and you can go through and you can do this on your time. But again, CJ Sims are very important. These things will really help you to think. And I'm sure you all have the answers. You could do that, put them in, but it's not going to help you think, okay? Go figure out why. Why did we put that in? Why does that work? And that's going to help you start thinking more critically because next quarter, most of you are on capstone. And then you're going to have to think a little bit more. Now, there are assessment tools, and they do look at development, which is the Denver Developmental Screening Test. It's not an IQ test. It measures personal, social, fine motor, language, gross motor, and all it tells you is that you need therapy. If you're not meeting a standard, then you need to institute therapy, okay? Has nothing to do with an IQ. It just measures where you are developmentally, and you need to have something to help you get better. So all of these things here work on growth and development and the influence. Well, number one, I'll always say um, growth, development. It's who you are, your nationality, your race. Are you the first child, the last child, the middle child? And it does make a difference. Male or female, the environment. Is it a happy, healthy home? Or is it a home that there's drug or alcohol abuse or physical abuse? All of these things do affect growth and development on children. Now, factor of family structure, you know, all of these things can affect a child and the way that they are. Is it, you just have your normal, nuclear family, mom and dad and kids, and they're all their own? Or are they blended? Or are you a grandma and grandpa who have your grandchild? Are you single mom, single dad? Are you two boys, two men, two women? All of these things influence a child in whichever way. There are different sort of parenting styles. I know that me, when I raised my children, it was a little different than my husband. Now, my husband's Jamaican, so his culture and the way he brings things up and approaches it are different the way than I think. And what was really refreshing, bringing up my grandson who lived with me for the first couple of years, I could see the differences and I can see the child, the way he responded to it. So we have the authentic. This is me, the nurturer. I'm the affectionate one, and then I tell them what they need to do, the discipline through guidance and talking. That's a me for sure. Then you have the authoritarian. These are the strict ones, punishment, discipline. This actually, I would even say, is my son who's in the army and has been for 24 years. This is the way it is. Yes, sir. And the way it has to be, right? It's because that's what he knows as being high level, in the service. Indifferent is when they don't care what you do and how you do and when you do. And there are families like that due to many different reasons. And then they're permissive. I want to be your friend. I'm not a parent, basically. And those are your older children, okay? So what they say is discipline should be focused on teaching, not punishment, okay? And the one way that we can take and give that child a chance to think about what they've done, timeouts. Toddlers, timeouts. And preschoolers, these are that group that timeouts work. And what is it? 1 minute per year of life. You're 2 years old, it's a 2-minute timeout. As I said, nutrition, nutrition, nutrition. We know that nutrition initially, cognition, gets this child, and then motor. Are they moving and turning over and walking and creeping and crawling and doing all the things they should? It does provide heat and energy, and it helps the tissues and helps the body, etc. And we know it's all those minerals and compounds and etc. that we need. School age children are the best ones to teach about my plate. It gives them the concept there is a proper way to eat and the why and how much that they should have. Doesn't mean they always get it, but at least I'm going to know about it, right? We know that there are some families that don't think food is a priority, but we know that a child who is not fed properly from birth, they're not going to be cognitively as far ahead or alert as that child who's had proper nutrition. I call it cognitively delayed, or they can call it mental retardation. Okay, they're behind. It's because why? Well, you put gas in the car to go, right? If you don't put food in an infant, their brains don't go. It sits. It needs that to grow. Obese children, we know there's a lot of issues with that. They're not moving around as well as they should. And then it's that peer and that bullying and all the things that go on with that. So cultural food differences. Well, I'm going to mention one. What about that culture that is all vegetarian? What things could they be a child be prone to because of that? Well, what about iron deficient anemia? They're not getting all what they need. Are they getting milk? Are they getting calcium? Are they getting those meat, protein? Are they getting it in another way that
Yeah,
they
that's what I
should?
said, protein. Mhm.
Yeah, I mean, and it does happen that way. So as nurses, we see a child not where they should be, and you have heard that, oh, these parents are vegetarian. There has to be other choices they could eat that could make sure that they're getting proper nutrition. You would tell the doctor, hey, why don't you order a dietary consult? And that could get them that information. So nutrition. We do not regulate fat in children. Up to ages 2, they need it for their central nervous system, okay? So we don't put them on 2% whatever milk. In fact, at 1 year old, we take them off formula and wean the breastfeeding and put them on whole milk because they need all that extra fat, right? Children can get really sick and really ill, and they can't eat by mouth. So, parental nutrition and tube feedings, enteral feedings, we give these things to supplement because without nutrition, a child does not survive. They're not going to grow, and their brains aren't going to be good because you're not giving them the fuel that they need to be what they have to be. So children in the hospital, they're sick. They don't feel good. They just had surgery. All different things, right? So we know that these children, let's see what we could give them to help them. Maybe giving them ice cream, right? Now you got fat and you've got, calories. We're giving them what they need. Also, there are families that manipulate food in order to because they a reward thing, okay? Another thing kids do is they don't eat because they want mommy and daddy feel bad for them. It's a way to ask for attention, right? Also, what if they can't chew it? What if they're having chemotherapy and their mouth is full of sores and they can't eat? All of these things do happen. So how much food should a kid eat? Well, they say 1 tablespoon of food for each year of life. And you should not give snacks, sweet drinks, or anything like that before children eat, okay? Because they filled up like on apple juice. My grandson used to love to do that. I'm like, no, 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 no. We're going to eat and then you can have your juice, right? And another thing that's very important, infants, what they do is they explore the world through their mouths, right? And now you have an infant who's so sick who can't eat for whatever their diagnosis is. Well, the one thing we as nurses need to remember is to give them that pacifier, that non-nutritive sucking device. We call it a soother, right? That calms them down because infants explore the world through their mouths and they calm themselves through it. So it promotes growth and development. So childhood obesity, we know why. What's going on with that today? Well, you've got more children not outside playing. Could be the environment. Could be that if they come home from school, mom and dad aren't home yet. They have to stay in until mom and dad come, so they're not out playing anymore. It's also today. Just think about your lives. You're so busy, and if you have a partner, the partner's working, you're working coming home, you go through McDonald's, you go through Burger King, and that's dinner. And because you don't have time to cook dinners, right? It's part of it. So they are more obese children because of their being sedentary, playing with electronics, not going out of the house, not playing what they used to go out and play basketball, baseball, riding their bikes. You don't see that as much anymore. So the thing about that is one of the things that we do to measure this is doing some sort of diary. How much did you eat yesterday? Tell me what your foods ate and try to make a plan for them, all right? And we look at the body mass index, your BMI. If your BMI is 90, I mean, you're close to obese. So trying to get those children down to a place where they should be. Now, oral health. You're thinking, why oral health? Why are we talking about that? Well, if your teeth hurt, do you eat? No. And also, we know that teeth in children, number one, the first tooth should come in about 6 months. My kids never had 6 months teeth. They were at 15 months and then they got six of them. But they're coming in, all right? And they should be not neglected. They need to be at least with a warm, wet washcloth, wiping them off or brushing them with a soft toothbrush to prevent decay so that they don't have their teeth hurting. Also, all these baby teeth are going to be coming out, and all the adult teeth are going to be coming in by the time they reach about age 12 or adolescence. Okay. Again, teeth can tell us a lot. It can tell us about some endocrine problems or other problems, but we need to do and teach good taking care of their teeth. They say all children should floss their teeth, but you have children about age 6 or 7, like first graders. They still don't have the ambidextrosity to do that, but it should be done to help their teeth. We know that they shouldn't be getting those sugary drinks. They say that they should brush your teeth after every meal and snack. And they also are like no milk, no juice to go to bed at night because it'll sit there, right? Apple juice, milk, it's sugar. It's going to sit on their teeth and it's going to rot it. So you have to be careful with that. I actually had my firstborn son had teeth look like that as a bottle mouth. I didn't know the difference. He used to take his bottle. This is before sippy cups. He's 40 years old now, so a really long time ago. But he would just take the bottle and the nipple and with apple juice, and he would run around the house with the nipple in his mouth, and his teeth did get rotten like that. So again, making sure that they don't get put to bed with milk or juice, water if that. In fact, they say you shouldn't do anything, okay? And they should be seeing the dentist. Brush before bedtime, replace that toothbrush, and then of course, storing those toothbrushes the way that it keeps them clean. They say at least every 3 months. And what if you're sick? What if you have strep throat? These are times, again, where these toothbrushes
Once a
should be
month,
changed.
ASAP.
So play. What do children do all day long? They
Play.
play. They play from the moment they're infants, right? When they can grasp voluntarily a rattle, they play, 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 play. A baby is born not knowing anything, nothing. They're lucky when you put something in the mouth that they suck, swallow, and breathe. That for them is the first thing they learn. So, what does play do? Well, you give them a rattle and they grasp it. And then they move their hand and they hear a noise. They go, oh, I like that. And they do it again. So now they've learned something else. And then, oops, they got into their mouth. And, oh, I like chewing on that too. This is all about manipulating and understand their environment. They also learn that if they cry, guess what? Mommy, daddy, grandma's coming, right? They're coming to get me. So again, that socializing, and that's part of their language. Hospital playrooms are great. We're at the hospital that I worked at has a great one, but remember, any child that has an infectious disease or oozing wound that's infection, they can't go there. It has to be more the clean child. It could be a child like with diabetes or almost ready to go home, that their infections are gone. And these playrooms in the hospital make it, they can express themselves And they could be creative, whether it's painting or coloring or gluing or whatever it is they do with them. And we know kids love computer games. You know, I mean, Roboblocks, the big thing today, right? I need some more Roboblocks, Nana. I'm not getting here. Get me some more. I'm like, yeah, no. Nana's not rich like that. So play, we need to absolutely encourage it on age appropriate, okay? Remember that when you're dealing with children and toys, that this example of not giving a fluffy toy to a child with asthma, the lint can go in their lungs, it could trigger an asthma attack. Just be careful of it. Also, little tiny pieces. Be careful with children under age 3, right? Got to be very careful. So appropriate toys for appropriate age children. As a picture, who would you give what toy to, right? So we know that, adolescent's going to play pool, right? And then you've got the infant, could be more playing with blocks, looking at those colored pictures. They start with black and white and they put colors on them. And then we get to toddler more into the letters, the blocks, and preschoolers with letters and they're seeing. I mean, this is great how you could see the difference, making sure that they're appropriate. Now, infants. I've gone through a lot of different things as we gone along to help you understand infants and the way that they grow. So look at one of the children that's difficult. What about that irritable infant? And there are infants, they're all different temperaments. Some are awake, alert, and happy and smiley, and they cry, mommy gets them, and they're happy, right? Well, there's other ones that really need a different style of parenting. This is they don't like bright lights, they don't like noises, they only like, you can't pick them up and shake them and bounce them. Just everything easy, quiet, smaller infants, snuggling them up, making them feel comfortable. And pacifier, remember, is a self-soother. And you rock them just gently. Should be everything slow and easy does it. My daddy used to say that. Slow and easy does it. And these children benefit from that. They feel comfortable with it. So some children also, if you have a child, um, everything's going on, all of a sudden they shut down, don't want you around, and we call that a child, a lethargic infant. Again, same things. We're avoiding bright lights, gently moving them, talking easy, and then let's sit up and look at their environment, without any demands, shaking toys in front of them and whatnot. Sleep, we know children sleep, infants about 4-hour intervals. By about 4 to 6 months, they might sleep all night long, 8 hours, if you're lucky. Now, you have to synchronize their circadian rhythm to the family. Now, I always worked nights when my children were, when I was pregnant with my kids. So they like to be awake at night, with me. So that when I was on maternity leave, they wouldn't sleep at night. So I had to turn them around into that circadian rhythm, okay? Remember, only on their backs to sleep, never on their tummies, never on their sides. We want to prevent SIDS deaths, okay? And again, when a child is crying, an infant, they should be soothed by the parent. That's what they expect. And if you are meeting their needs, this child's going to be a happier, healthier baby. Now, immunizations. This is a big thing where I've seen parents, no, it's against my religious belief not to immunize. Now, I respect parents' beliefs, whatnot, but remember the importance of immunization is to prevent these really bad diseases. Also, it helps me as a nurse, you as a future nurse, and all the children that you're working with from getting these diseases because they were not immunized. Okay. We know that if the child is sick, there will be some delays, right? In immunizations. Sometimes you're doing your 6 month month immunizations and it's 10, 12 months because they were sick in between. as long as they're getting their immunizations. And of course, keeping accurate records, very, very important. Car seats should be rear facing in the middle of the car seat, believe it or not. Less than 2 years or a weight limit of 30. And then I ran into this. My grandson weighed 25 pounds and he was 2 years old. He was a peanut growing up. So did we turn him around? Well, we asked the physician, right? The pediatrician. Well, it's not necessarily the weight, it's on muscle control and neck control. And he said, yes, you can turn them around because he was older than 2 years old. Always worry about safety and falls. Children, now, for instance, let's think about that infant. I said at 6 months, they should be able to roll over from their front to back, their back to their front. What if you left them on top of a couch? They're going to roll on the floor. Or if they're on the changing table, they're going to roll on the floor or on the bed. So never leave them unattended. Okay. Crib rails need to be up. And if you have stairways in the house, make sure that you've got them, protected so the kid can't get through. And always pools. As I'm talking with my grandson, this little boy at age 2, because I taught him, because I have a pool in the backyard, he could jump front flip, back flip, and no swimming arms, nothing by the age of 2. And he will not, to this day, and he's 7, will not go in the pool without asking me first. He knows better because it's safety, safety. Okay. So pool safety, big, big thing. Again, toy safety, no small things. Make sure that the toy you give them, it's going to give them something that they can learn about, right? Because that's very, very important. Illness prevention, again, periodic health checks. They're going to be going in 2 weeks when they come home from the hospital, 2, 4, 6 months, 12 months, 15 months, 2 years. These are things that they all do, right? So making sure those checks, well, they're pretty well, it was all of those immunizations there, right? Now, vaccinations, yes, we want to get them the vaccinations that they need. That's really important. I've said that again. Education for parents. Now, one of the things with illness is changing the diapers. Think about an infant with a diaper rash because you didn't change it good enough. That baby is not going to sleep at night. And you know something? You're not either. Once that baby urinates or stools during the night, it's going to wake you up because that burns and that does hurt. Again, monitoring growth and development. That's why I say every visit we're doing height and we're doing weight and we're doing all those things, for these children to measure them. And then ensuring adequate fluid and nutrition. And the way we ensure that is through monitoring height and weight. Physical examinations, we know hearing is done before these children as newborns leave the hospital anymore, and then of course, going through all of those grids, again, it's height and weight is going to be telling you what's going on. And if that's a child with that different nutrition, like, vegetarians, making sure they get that counseling that they do need, and that the parents get handouts or have that nutritionist come and visit them and talk to them. So developmental milestones are things that kids do, which are normal, right? So we know that initially an infant is going to sleep and wake up, and we call that the sleep-wake cycle. We know that they're going to be smiling and cooing. Then all of a sudden, you give them a cup, and they're going to be able to drink it and hold it. Separation anxiety. You're going to have a discussion question on this, but this is when a mother has to leave a child in the hospital and has to go home and leave that child there alone. This child's going to do what at first? Scream and yell and go bonkers. They don't want to be without their mommy, right? Especially those toddlers, older infants, right? That's your group that really suffer from that. And they go through 3 stages of it. So we'll go over that more as we get to that discussion question too. And remember, development on this child and this child are always different. So never try tell them just because your son did this doesn't mean your daughter's going to do it. Your daughter could be faster or slower as long as they're moving forward in all of their development. So grasp reflex, okay, this is fine motor skills. Grasp reflex starts as a reflex. At birth, you put your finger next to a baby's hand, they're going to grasp it. That's a reflex. Then, as they get older, you're going to give them a rattle and voluntarily they're going to grasp it. And that's what grasps are. Prehension is that 5 to 6 months and it goes in orderly sequence. The parachute, ever take a baby, turn them over to put them in a crib, their hands and their feet come down, or you're putting them on the floor, that's called a parachute. And then after they can grasp, they're going to go sit in a high chair now and start to pick up things off the high chair to eat. And usually it's a smush first, and then it gets into that little fine little pincer grasp. And they could take one little puffball at a time or Cheerio, whatever it is. So, Erickson, emotional support. It's all about trust. So you've heard me talk about baby cry. Mommy, somebody go pick him up. This baby's going to be happy, right? What happens when you don't go and pick them up right away? They are going to be not this happy baby. Thus, infants who are consistently picked up tend to cry fewer times, and they are less aggressive as they get older because all their needs were met. This is the trust that they have. And Erickson is one of your theorists, says it's trust. And then when they don't do something, parents don't come in and they're left to cry, that's called that mistrust. And that's your unhappy baby who's going to cry a lot and be a little bit more aggressive. Never try to force a kid to do what they're not ready to do yet. If they're 4 months old, they're not going to walk, or crawl yet. So always be aware developmental stages, what a child is ready for. So here we are, first year. We've mentioned some of them already, so let's go into them one by one. Well, birth weight. Babies are born at 7 pounds, let's say. 6 months, they should double. They should be 14 pounds. And triples by the time they're 1 year old, okay? Their birth length increases by 50% at 12 months. 1 inch every month for the first 6 months they grow. At birth, babies' heads are big and the chest is smaller. By about 1 year or so, they should be equal. And then the head will get less than the chest, okay? You have an anterior fontanelle, soft spot, that should close about 2 to 3 months. Excuse me. This one on top should close about 15 months. The posterior in the back should close about 6 to 8 weeks. So if they close too quick or not, or they're still open, these are things we need to look at. They should be smiling by 2 months. They should hear you coming and turn to look for you about 3 months. That Moro reflex is a startle. You make a loud noise, or they're in a crib and you hit it and they startle. Hands and feet come up. About 4 months old, they stop. Their head, when they're born with no head control, should be really good about 4 months. But as I said, about 5 to 6 months, they should be able to turn themselves completely over. They play peekaboo about 6 months and they giggle with you now, right? Now they got a rattle in one hand at 7 months and they're putting it in the other. And then stranger danger, as I call it, stranger anxiety. This is when, as a nurse, you're trying to get the child to put them on the scale, this infant, and they're, oh, I want to go back to mommy. That usually develops about 7 to 9 months. They know that you're not mommy or daddy. At birth, they see through each eye separately. They don't work together. But about 9 months, the eyes work together, so depth perception starts, where they can reach and grab a toy and get it. They sit unsupported by 8 months. By about 10 months, they should be crawling. Now, it could be crawling backwards first and then forward, but they're crawling. That fine pincer, that picking up that little piece of Cheerio like that, not a smush face, it's a little piece at a time. That should happen there about 10 months old. And then by 1 year old, they're going to say about 4 different words: mama, dada, hopefully nana, right? Those things. And remember, these children are exploring the world by oral and then that movement trying to get to those toys when you put them on tummy time. So let's talk about Freud. Freud's anything sexual. Oral is what an infant is, right? What did I say about infants? They explore the world in their mouths. How do they soothe themselves? With their mouths, right? Whether it's a finger, a pacifier, a toy, all of these things, it does calm them down. Now, Piaget is all about figuring things out. As in, I grasped that rattle and then I moved it. Oh, I like that noise. Now I moved it again. It's through touch, sight, taste, hearing, and smell. Okay. And these things, make that sensorial motor. Look at the word sensory motor: touch, oral, ori, and motor, moving it around. That's Piaget. And as I said, Erickson, trust. I cry, somebody picks me up, I'm a happy, healthy baby. Mistrust, nobody comes to get me. It could be in a broken home, it could be with drugs, could be alcohol, could be abuse, something, nobody's getting them. And that's going to be that unhappy child. Nutrition. So, as I said, infants are a lot like adults, the elderly. Their digestive systems don't work as well. I mean, adults do to different reason, but children, it's just not mature enough yet. We know that that first 6 months of life, they can't tolerate food. You give them fruit, you give them vegetables, you're going to see it in the stool and chunks of it because that's what it is. And it's because they cannot digest it yet. In fact, even at 6 months, when we start to introduce foods, you're still going to see a little bit of something in that stool. So solid foods, we start at 6 months. And then what happens when you give that baby that first spoon? You see that tongue sticking out in that infant? Put the spoon in, and they push it out. It's called a tongue exclusion reflex. They don't know what to do. They all the time. And now you put something, I don't know what to do with that. And then it does start to figure out how to put it in and how to get their food. As I said, at 6 months, the GI tract is mature enough, but it doesn't mean you're still not going to see something in the stool. It doesn't digest everything. I'm going to give you an example as an adult. Do you eat corn? Don't you see corn in your stool? That's still showing you what you might see with an infant with different things. The GI tract just doesn't like everything, okay? So at 4 to 6 months, we know their muscles are getting more mature, and then they're able to do that chewing up and down. Even with that extrusion going on, they'll figure out to keep the tongue in, and then they could start eating real food. And you give real food before you give milk. So the infant gains 4 to 7 ounces per week for the first 6 months. As I said, you're going to double it. One of the questions, especially on your breastfed babies, how do I know my baby's getting enough milk? Because I can't measure it. I can't see it. Well, if the infant has at least 6 wet diapers a day, we're doing good. And if the infant's sleeping well, we know we're doing good. So first 6 months, breast milk or iron fortified formula. At 1 year, we try to wean from breast and wean from formula and put them on cow's milk. And it's whole milk. We want them to have the fat. We do not give these children fat. They need it for their central nervous system. Contraindications to breastfeeding, and here's all of them. Galactosemia, phenylketonuria, that you need a real special formula for. Those are the little dots that they do at birth. You see that little card, and they have 5 dot circles. That's how they measure that. It has to do with the way that they process food. HIV, chemo, radioactive drug use. I mean, remember, you do drugs, it's going to go to the baby. And of course, TB. Safe bottle feeding. Well, we know that every food that we feed a child, an infant especially, we need to check the expiration date and to follow the way that they tell you to mix the formula, not try to make it your own. Never, ever, ever put it in a microwave because you don't know if the temperature of that formula is hot and you could burn a throat and you could cause swelling and problems with breathing, right? So another thing is when we're feeding an infant, if there is milk left, we don't save it because it will grow bacteria, because some of the baby's saliva will get in that bottle. Prebiotics, probiotics, prebiotics, again, is helping that GI system work well. And then the probiotics are used when you have an infant child with diarrhea. The treatment is you're still going to feed them. You're going to give them oral electrolyte fluid, but you're going to give them probiotics because that replaces the GI tract flora and it will stop the diarrhea. So feeding 4 to 6 months, we know is when we're going to be start feeding. Their sucking's better and their munching, chomping is doing well. It's the first food that we give. Rice cereal. Why? It's less allergenic. You should not mix cereal or food in a bottle of formula to give it because it's easier. Okay? Many parents want to do it. Just don't. We need to get them to use their muscles, and it's practice that helps it. Also, one food at a time, 4 to 7 days in between the introduction of another food. And why? Because kids can get allergies to food. I mean, it could be a simple rash, or it could be a diaper rash. It could be an anaphylactic reaction. So there are foods that we say not to give, and there they are there. Orange juice, fish, nuts, strawberries, chocolate, and egg whites. As I said, weaning, when should you wean? Well, about a year into it, these infants are eating a lot, drinking a lot, and if we're starting to see that they're biting mommy's nipple or biting the nipples on the bottles, it is time to look for feeding them food. And we start easy and wean them off. And then usually we'll just breastfeed at night or bottle feed at night for that comfort, okay? And they say that fruit juices, we can start those about 5 to 6 months of age. Infants, if you think about how quickly an infant's growing, we double their birth weight at 6 months and triple it at a year. Can you imagine the amount of calories is needed to be able to do that? So they need 3 times more calories than adults because they're growing that quick. They also need good fats because of their brain, right? And at 6 months, we know we can feed them because their GI tract is good. And we need a good, well-balanced diet. And never, ever, ever put them on a low-fat diet before or younger than the age of 2. Organic and natural foods, we know that they don't contain any additives. We know that it's important because, there's nothing in there. There's no hormones, no fertilizers, etc. is actually a good thing to use for children. And again, reading the labels on baby food is important. All of them are good. So toddler, my favorite group of kids, ages 1 to 3. Me, mine, I do. And these children are the hardest and the sweetest to take care of, okay? We know that they're not dependent as much on you as we used to think. They're able to hold their own bottles, even move around. Even up at age 3, they're changing themselves, started potty training, all of these things. Now, Erickson, you're going to see theorists on your first exam, about 7 questions. Erickson, this one definitely you'll be seeing trust versus mistrust. That is going to be your infant, but toddlers, autonomy versus shame and doubt. Like, what does that mean? Well, automatically mine is autonomy. Mine, me, I do. That means let a kid try to do something. Don't do it for them and don't stop them unless they're going to hurt themselves. Because the shame and the doubt is when you don't let them try. You need to give them the opportunity to do. So autonomy is automatically me, mine. I'm going to do, I'm going to do. And the shame and the doubt is mom and dad and grandma saying, oh, don't do this. Let me do this. Well, let me help you. No, you need to let this child try. So daily care, again, promoting that independence, right? Making sure um, that you've got clothes that they can get in and they can get out. Because again, me, mine, I'm going to do it. I mean, they might put a shirt on backwards, underwear inside out. Doesn't matter. They're trying to do it. And of course, daycare should always be something that's of quality and that meets your needs. Guidance and discipline, we don't punish, we give limit setting. You can't do this, you shouldn't, whatever. All right. And if they're not listening, it's that timeout. What did you do wrong? And then you're going to sit there. You're 2 years old, you get 2 minutes on timeout. The one thing about temper tantrums is as long as they're not hurting themselves, you need them to let them have their moment. These children do these temper tantrums because they want what they want when they want it, because it's me, mine, I do, right? They are very self-centered. Of course, we're always going to do things to protect from injury, whether it's, you have a wine rack low. No, that bottles of wine are going to be all over the floor, the plugs, all the pots on the stove, making sure injury protection is always important. These kids are the ones that are in the cupboards. They're the pots and pans from the cupboards everywhere. And it's just part of what they are. They're curious and they're mobile. So today, federal government, you need to have non-flammable sleepwear. And there's little messages on it, flammable. We know that there should be childhood caps on medication bottles. I mean, these kids will eat anything. Anything goes in their mouth, right? Exploring the world. The one thing we don't think about is the hot water heater, making sure that it's not too hot, right? And then, of course, um, any smoke, carbon dioxide detectors. I mean, in any house apartment, it should be there. And then, years ago, we had different cribs. And those slats were wider apart. And actually, kids choked themselves getting through and hanged themselves with their heads getting out of cribs. So making sure that they are right and proper. And of course, proper car seats. So toddlers, the brain's not going to be growing as fast, okay? The head and the trunk are growing slower, so you're not just going to have that long trunk and small legs. It's going to start to get a little bit more of a normal, proportions. We know their muscles are going to go from this wobbly, wiggly child to more and more agile, right? We know that their these kids are able to get up and move around a lot better. So, toilet, potty training. The one thing about potty training is bowel training happens before bladder. They can feel that bowel there. So they do actually train that first, okay? It should be accomplished between 2.5 to 3 years. Some kids are earlier, some kids are later. As long as everything else is okay, it's all right. Sensory motor and cognitive development. Again, touch and mouth and moving and thinking and figuring things out, right? These children need to be shown things. I call it concrete. They've got to see it, touch it, feel it in order to be able to repeat it. Okay. Um, these children now are in that point where they're starting to take a broom and ride it like a horsey, and their arms out and they're being an airplane. These are sort of things that they're starting to do now. Their speech is getting more and more. Now, they're understanding more than they can express. So, having a young child in the house, you'd have to say, I, okay, I don't understand. Can you show me what you're trying to tell me? And most toddlers at this point, they understand what you're saying and they will go show you. Okay. And again, I think the hardest part is as a parent or as me as a grandmother, having a toddler talking to you and you're not understanding, let the kid know it's okay. We'll figure this out. That empathy. Let them know, no, you're doing a great job. I have to figure out what you're just trying to tell me. Because they do get frustrated. Now, screening for autism, we usually don't do this till about age 2, okay? But you're going to see some things up to that point. They're not going to be pointing, gesturing, no words, and their language, social skills are really not going to be great. Before this, okay? Now, we can't just say it's your child is autistic because it could be some other thing that caused this child not to be moving ahead the way they should. So rule out number one, hearing. Can they hear me? Right? Also ruling out things like lead poisoning, any musculoskeletal dystrophies, any of that stuff before we put the label of autistic on them. So toddlers, what do they do? Well, we have the birth weight should be quadrupled by 30 months. At 2 years old, they're half the height they're going to be as an adult. Everything slows down now. So you gain a little weight and then you get taller. It's like the stair step, the way it goes now. They looked bow-legged and pot-bellied and they're waddling around, moving around, right? All of their baby teeth should be in by age 3. And then remember that fontanelle should be closing about 12 to 18 months. I remember the first time my grandson, about 18 months, took a ball and threw it at me. I was sitting on the couch, just missed my head, but it was really quite, he threw it really strong. So they throw a ball overhand and it will happen. They can kick a ball. It doesn't have to be hard, but they're kicking that ball. They should be able to feed themselves. It doesn't matter if the spoon is upside down or backwards. They're putting something from a food into the mouth. That's what that's talking about. Daytime toilet training started about 2. Most children do. 2 to 3 word sentences. They can tell you what they want. I want juice. I want, whatever it is, a banana. I'm hungry. Let's go outside. Let's go out. You know, things like that. They will be starting to tell you. They're going to know their names. And remember, toddlers, this is the biggest age temper tantrum. Me, mine, I do. You don't let me do it. I'm going to have a temper tantrum. So Freud, again, sexual type things, it's anal, right? Potty training. Why is it anal? Because bowels start before bladder training and potty training. Piaget, we're starting to think by touching, feeling, moving things, as in riding the broom, putting the arms out, by throwing a sippy cup on the floor and knowing mommy's going to come pick it up. So when you want mom, throw that sippy cup back on the floor because mommy's going to come and pick it up. They start to learn these things. They're really smart. They start learning, words, but they don't really understand all about why they do things or things are done yet. They're trying things out. It's part of the learning process. And again, egocentrism, all about me, my ego. I want, I need, I do. This is what their ego is. And again, what does Erickson say? Autonomy, automatically mine. I do. I want to do. Shame and doubt. You're doing it for me, and I wanted to do it. Let me do it. Okay, that's Erickson. So nutrition, we don't need as much as we do
Professor,
as infants. Yes.
I'm sorry, I don't mean to be rude. Okay, so thank you for breaking down that shame and doubt, but what it means. But so shame and doubt wouldn't be okay, so you go out of your way to do something, you did it and you did it wrong. So I'm fussing at you about doing it, which is kind of like the whole shaming you, right? Instead of talking to you letting you know you did it wrong, I'm shaming you. And then so now you start to doubt yourself later. Okay, well, I can't put my shoes on because grandma said last time I did it, I put them on the wrong feet. That wouldn't be shame and doubt, or that's kind of like a part of it, or what?
Okay, so the shoes, you have to allow them to try to put them on, whether they do it
Okay.
right or wrong.
Right.
Okay? The shame and doubt is when you don't even let them try.
Oh, okay.
That's
Okay.
what that means.
Okay. So
Okay?
it's not shaming them for doing something wrong.
Oh
And now it
no.
messes with their self-esteem. And so they start to doubt themselves later in life. Like, I can't put this on because grandma said I did it wrong last time. Or
Exactly.
mommy said I did it
Exactly.
wrong. Okay. So I thought that's what that
Exactly.
meant. Okay. Thank you.
Exactly. No, that was a great question that really explained it very well. I think most of the other students are gonna, oh, now I get it a little bit better. You've got to let them try. Sometimes I even think with that is, the one thing my grandson like to do is, how toddlers like to jump from couch to couch or couch to the hassock or couch to the floor or whatever, and it's too far. Well, if it's too far, you're going to say, wait, let me put something closer to you. Now go ahead. You
Hmm.
still let them do it.
Okay.
Um, and then you show them, or they've done it, you say, oh, next time, it's like a teaching moment for the child. And it's not going to take one time, it's going to take a couple times. But again, you're teaching them by allowing them to try.
Gotcha. Gotcha. So you don't want to handicap them. That's what you're saying. So that's
Exactly.
what you're doing with shame and doubt. You're
You're
handicapping
teaching.
them.
You
Okay.
should teach them to be more self-sufficient, but safely
Okay.
and
Gotcha.
efficiently in
Thank
the right
you.
way, right? Oh, you're
Hmm.
welcome. So nutrition, as I said, these kids, when you become a toddler, you're an infant, you're eating like crazy all the time. You become a toddler, and all of a sudden they don't eat as much. They become picky eaters. I mean, their mouths and their taste buds change. So they don't like sometimes textures of foods, or they don't like the flavor of foods. As infants, they don't know that that cereal they're eating is nasty or that formula. Have you tasted baby formula? I mean, it's bleh, but they don't understand it yet. As toddlers, they're starting to understand their mouth and they're starting to understand their taste buds. So they stop eating a lot of food. I know some infants, it's macaroni, cheese, and chicken nuggets and apple juice. That's what they want. And it's part of it, and as long as they are gaining weight and they're alert and they're moving forward cognitively, it's okay because they're not gaining as much weight as they used to. These children, they say 1 tablespoon of solid food per year of age. Much, is it? We think they need a lot more than that. I know my husband watched him, my grandson, like, well, you only ate this and this and that today. I'm like, that's more than enough. He goes, no, he needs to eat more food. It's because you think they need more, because as infants, they did eat more. And they like little tiny little pieces. Again, they like to pick it up and play with it and let them smush the food around all over the high chair. It's part of that exploration, right? Picky eaters, like I call it at this time, they go into the physiologic anorexic because they're barely eating because they're just so picky, okay? Remember, some children, this aversion to textures and stuff could be something else, and it could be more of a feeding disorder, okay? So let's recap here. We got theorists, Freud, psychosexual, anything to do with personality development. This is the oral, this is the anal. Erickson is all psychosocial, how you relate to other people. Okay. This is like, I trust you because you come get me. This is that autonomy versus shame and doubt, right? I want to do, let me do it and try, mommy, unless I'm going to hurt myself. And if I do it wrong, just tell me what I need to do next time. But let them try again. Don't put the shoes on for him. Let him try it till he gets it correct. And yes, that takes patience, a lot of patience. And then Piaget is thinking, I have taken that rattle, I did a reflex grasp. Now I'm volunteering getting that rattle, and it made a noise. Oh, I shake it. There it is. Or that's the hands up in an airplane that's throwing the sippy cup on the floor. I'm thinking now. And then Maslow. Maslow's all about what your needs are. We need our basic needs. We need food and clothing, and shelter, basic. And then it goes up to what makes us feel good in our esteem. Again, there's these YouTube things. I want you to look at them slowly. I think I explain them pretty good to you. Now, Erickson has a lot of different stuff. I'll be going over them as we get to each one. So we have already talked about trust versus mistrust, autonomy versus shame and doubt, right? We're going to go over that. And again, more about it. Piaget. Piaget is all about thinking, right? And stranger danger is part of it. They know mommy, but I don't know you. So until I know you, I'm going to be, scared of you. The one thing I didn't discuss was object permanence. You show an infant something that they like say the rattle, and you hide it, and it's not in sight. An infant on tummy time knows that rattle's going to be there, and they're going to try to wiggle themselves to get it because they want that rattle. Even though it's not in sight, the object is still there. Object permanence, okay? And then those developmental stages are going from taking that little rattle and holding it and then shaking it and then in the mouth, taking the sippy cup, throwing it on the floor. No, mommy's coming because we saw it happen. And it's learning and learning and learning. It's all about that thinking. So again, the sensory motor, I've just gone into those things, and pre-operational. It's getting to your older children. It is toddlers going into your preschoolers, and I'll go more into the magical animism as we get up to the preschoolers, because again, in Piaget right now, it's all about me, and mine, and then trying to figure things out. That's that touching, playing, moving, and knowing what they can do. It's learning how to tie their shoes. And then, of course, the Maslow's hierarchy. This is all about what do I need? And then what makes me feel good at the top of that? That becoming who you are, and then your esteem, right? So Maslow's is something that we will always be looking at. You have basic needs, and then what makes you feel the best. Any questions? You're doing great on time. Now, I have a question. I can usually go straight through the whole lecture and get you out early, or I can give you a break. What would you like to do?
It doesn't matter.
Does anybody want a break, or you want me to go
Yeah,
through and do
Malachi.
our cahoots and we'll
Yeah,
be done?
Malachi.
We're almost finished.
Yeah, do the Kahoot and then that's it.
I usually will get you
Oh,
out
yeah.
of here 20, 25 minutes earlier. I'll go straight through. Yes, I know you have to go to the ladies and men's room. I get that. Sometimes you got to go answer the door. I get that. But, just come right back. All right, let's go ahead. Let's do this one. Have you done cahoots before?
Yes.
I think they're great. It's something I've been doing for a few years now. Take your phone camera, put it on that little code there, and you'll go right to the cahoots. I will be sending you this Kahoot on the announcement that will say week 1 recording. It'll have the recording for this lecture. It will also have the Kahoots, and I'll also put the PowerPoint there. I'm also going to send you a normal vital signs, and I'm going to send you some theorist handout for you, something to have, okay?
It's not letting me scan it.
Now, if you can't scan it, go to kahoot.it and you put in the code, okay? I don't look at these. You're not scored through these. You can put your names down. This is something for you to practice to have those concepts that you need for quizzes, exams, and your HESI, okay? So don't think that I'm going to go back and look, oh, well, Ricardo did it really good, but Mila didn't. No, I don't do that. This is here for you to have fun, to try to beat your partners, your classmates, and try to figure out what do you need to look at for next week for the quiz, right?
I'm trying to go to it, but I can't.
And you go to kahoot.it. If you can't do your camera and click on it that way on your phones, go to kahoot.it and put in the game code. You tell me when you want me to start.
Hold on.
Okay, I'll be waiting.
Okay.
Well, look at that.
114. Oh, 1 minute. I'm sorry.
That's all right. Don't be sorry. I always say never be sorry to ask a question because you don't know the answer. Don't ever be sorry when you need extra time. It's okay. I'm extremely patient. You with me?
Yeah.
Here we go. PNR 204, week 1. It's nice to meet you all so far. It's going to be a fun quarter. The nurse explains that permanent teeth begin erupting at what age? Well, we know that baby teeth are in by age 3. We know that permanent teeth start falling out when they start school age, which we have 1 to 3 is toddler, 3 to 5 is preschooler, it's age 6. At age 6, now, it doesn't mean everybody's first tooth is going to be coming out at age 6. My
My kids did
grandson
that 5.
didn't till 7.5, and he had his first tooth came out. So again, it's one of those, this is usual. Okay, this is book. The one thing that I forgot to tell you, forget you have children. Because if you rely on what you think about your children, the book is all different. I always say that student who doesn't have children not around them, there's nothing I have to wipe out of memory. It's just the book. So as a mother, just remember that, okay? I do the same thing. What age range is considered infancy? And this is tricky. It's 4 weeks to 1 year of age. And let me tell you why. The first 28 days of life, you're called a neonate. Neonate, neonate. At 28 days or 4 weeks, up to 1 year is an infant, okay? A mother is concerned that her second-born is not reaching milestones as quickly as her first child. How would the nurse respond to that? Remember, all children are different. And the only way that I would be upset is if they're not meeting any milestones, right? If they are 8 months old and they're still not lifting their head up, that's a problem. That should happen at 4 weeks, 4 months old, right? So as long as they are doing some milestones and moving forward, it's okay. There's some children at age 12 months are walking or 8 months walking. As I said, my kids never walked. 15 months they ran, and it's normal because they were meeting all the other milestones. So it is normal. What food may cause botulism if given to an infant?
What is
This is
botulism?
Botulism is a disease where it causes paralysis of the airway and can cause the airway to close down and muscle spasms. It is due to an infection type of bacteria that gets into honey, Karo syrup. Now, I was told, as a new into the emergency room, and a parent who said that her baby was constipated, so she gave it honey. Her grandmother said a little bit of honey would help them be not constipated. Well, this baby had
And it was.
botulism, and they were extremely ill. It required intensive care unit, intubation. I mean, very ill, but the kid did make it. But botulism, we should never give honey to an infant until they're 2 years old. Okay? We don't know when was it sterilized, right? We don't know the honey. Where did it come from? There's too many ifs, ands there. What characteristic of physical development best describes the development of an 8-month-old child? What did I tell you an 8-month-old child should be able to do?
Sit up 6 to 8 months. Sit up.
Yes, ma'am. You remembered what I said, didn't you? Yes, they should be able to sit alone unsupported. And that's the other word that could be put here, by themselves. If they are not sitting by 10 months alone, that's a problem, okay? This is the way that we look at infants. Which milestone would the nurse be most concerned for a 12-month-old infant with a well child checkup? What should they be able to do by 12 months? Well, we've talked about they lift their head, they turn over, they crawl, they can creep, they can stand up, and they can take steps by 1 year old. That's all the motor stuff. So if they can't pull themselves up sitting by 12 months, they're really delayed because they should be sitting unsupported by 8 months. Okay. So these are little things you have to, which What should they be doing up to what point? Okay, that's not normal. They need early intervention. What technique should be used to soothe an irritable infant?
Swallow. Oops. My bad.
It's a multi-select here.
Oh, it's a multi-select?
Had multiple.
Oh, man.
So again, how do you soothe any infant with their mouth? So the non-nutritive sucking or a pacifier. And again, when you swaddle them, put their hands up, they feel comfortable and they'll relax and they'll go to sleep. There's no vigorous rocking, there's no changing positions, there's quietness and there's no noise and there's no lights. You know, it should be very calming experience for that infant. They respond better to it. Parachute reflex and usually occurs in an infant at what months? That's when you turn them over, put them down on the floor, and their hands and their legs come up like a parachute. What they're doing is they're protecting themselves. It's an instinct. It's like a cat. When you throw them on the floor, their hands and their paws come up, right? To land on their feet. Same thing an infant does, and it's about 9 months. About 9 months, their hands and their feet come up, protecting themselves. Parents of a 2-year-old child report that he is inconsistently, frequently says no. Is that right? A toddler, 2-year-old. Me, mine, no, no, no is absolutely normal for these toddlers. And it's negativism because everything is no. Can I do this? No. Can I take that? No. Do you want to do this? No. It's just the word that they know at this point. It is absolutely normal. At what month do toddlers usually recognize sexual differences? Well, remember, what do they do as toddlers? They start potty training. They start to look what mommy's doing and what daddy's doing, right? So what age would you figure out from just knowing that information? This is how you take questions and tear them apart. It's about 2. Because remember, they start potty training around age 2. That's what they recommend. So do you see how I took that question and made it so you could figure it out? What is the cause of most childhood deaths? This says childhood. It didn't say infants.
Oh, man.
Uh,
I
again,
answered that too quick.
yes, and it is accidents, unintentional accidents. You know, things happen. Kids climbing up the front of dressers and TVs falling on their heads. And yes, I've worked in the ER, and yes, I've seen these things happen. Or climbing up on the balcony outside and climbing over on the second floor, going to the first floor. I've seen these things. It's unintentional, and that's when it happens. You blink and a toddler's somewhere else. It's the thing that Jerry Seinfeld said. Having a toddler is like having a blender turned on with the lid off. They're everywhere all the time. They move quickly. According to Erickson, what is the correct stage of development for the toddler? You know this one. Automatically mine. And don't tell me what to do because you're going to make me feel bad. Let me try to do it. Let me try, even if it's wrong. You can correct me, but let me try again and let me try again. Don't do it for me because that's the shame and doubt.
Trust versus mistrust would have been the infant, right?
Yes, ma'am. What guidelines should parents of a toddler follow when feeding solid foods? Remember, you've gone this infant eating like crazy, you become a toddler and they hardly even eat, but they're not gaining much weight. They don't gain as much height and weight during that ages 1 to 3. 1 tablespoon of food per year of age is all they need per sitting. Which type of play is typical during the initial toddler years? Now, we didn't go over all the plays. So pretend play is, what it says. Sharing. Do toddlers share? Me, mine. No, no, no. No, they don't. Cooperative play is organized. It is where there is a goal in the end. Cooperative is like checkers, or like let's build with Legos, let's build a house together. There's a goal in the end. What do toddlers do? Here's a toddler, here's a toddler, parallel to each other, both playing, and they're not sharing any toys at all. That's a toddler. How multi? What characteristics are displayed when a child experiences separation anxiety? Now, I didn't go into all the stages. As I said, separation anxiety, you're going to have a great discussion question on it, and it goes into it. We know that kids sometimes have to be left alone, and initially they're going into protest. They're screaming and yelling, and they want mommy, and nothing satisfies them. Then they go to the point where, all right, they're not coming, and they regress, and they suck their finger. They might even need a diaper where they're potty trained in between. And then all of a sudden, mom comes back. They haven't been there, and they're detached. I'm not even, you're not even here, mom. You haven't been here, and they ignore them. Very, very common thing. Separation anxiety, 3 stages. What is the most important nursing intervention to promote a positive hospital experience for a 1-month infant? You think 1-month infants don't know what's going on, right? I'm telling you, I'm so amazed working so much in the newborn ICU and cardiac ICU, which is mostly infants, congenital heart defects. They're very smart, extremely smart. And they do understand those same consistent caregivers. You're thinking a 1-month-old that's too young. I'm telling you, it happens. They know who you are. What are the best foods for the nurse to recommend for a 2-year-old diagnosed with mild constipation? What do you think? Well, constipation, you need roughage. What here is roughage? Fiber, right?
Mm-hmm.
Simple as shredded wheat, which that's all fiber. And of course, prunes. We know prunes always, will help the bowels move really well.
Yeah.
Again, 2-year-old, is that good for them? Yes, they will eat stuff like that, depending on how it's prepared. A group of children are observed playing house, each assigned a specific role as mommy, daddy, or child. At what age do you think this happens? They're playing house. Are they toddlers? A group of kids? They look like they're toddlers, are they? So this is actually the preschoolers. So we'll go into it next week, but this is something, to get ahead, to start having you think about it. Infants, we don't worry about playing. They play by themselves. Toddlers play by themselves and they don't want anybody to bother them. Leave me alone, it's mine. But then preschoolers, they start playing together and doing things. So ages 3 to 5. For how many weeks will the infant experience passive immunity from his or her mother? So that means the immunity is mommy at birth gave that baby her immune system, right? Passed it over. How long do you think it lasts for? Remember, all of these things tend to go away after a while. That's why at 2, 4, 6 months, we're giving crazy amount of immunizations to protect them. And it's about 1 year when it starts to go away. So up to that point, we're giving so many things to protect that child, but it is 12 months. Another multi. What characteristics are present in a well-nourished child? You got to look at what these answers are. Pale mucous membranes, that means they're probably anemic. That's not well nourished. Protruding abdomen, as a kid gets older, the abdomen starts disappearing, and that's usually due to excess of fat or stuff going on them. But shiny hair, regular stools, absolutely, that's your well child. And of course, height and weight are where they should be. They're getting bigger every visit that they come into the doctor's.
Professor, I thought you said when they get that little pot belly, they're eating good.
The younger kids. A newborn infant will lose about 5 to blank percent of his birth weight by day 3. Or so you were talking about the pot belly. First of all, yes, as infants they have the pot belly, but by toddlers it starts to get flattened. Okay.
Oh, okay.
When they're older and have this big fat belly, it's usually intolerance to fat. Fat causes gas. So you'll see that. Plus, they're not moving their bowels well. Infants lose 5 to 10% of their birth weight. You'll see a baby born at 7 pounds and they go home and they're maybe, 6.3 pounds. Absolutely normal. And then they start picking up weight like crazy, right? Because then they double the birth weight. Why do they lose so much weight at birth? They're floating in water, they're full of fluid. So they lose it initially, and then they'll start to gain it back. What does self-feeding help to develop in the toddler? Again, think about a toddler. Autonomy versus shame and doubt. Does that make big sense or what? Good job.
Yeah.
Good job. Why is a 4-year-old child likely to obey rules? Now, there's another theorist called Kohlberg, and Kohlberg is all about morality. And it's all about doing right and doing wrong and having, consequences for each, right? So the 4-year-old preschooler, they are starting to really understand. They don't want to be punished. They want all the rewards. They don't want to be punished. Them and even the school age children, they don't want to be punished. They try to please. They try to do always the right thing. Most of them. You always have a few. What is the earliest age at which an infant is able to sit steadily alone? Well, you know this one. And that is at 8 months. Very good. And the other word is unsupported. What is an abnormal finding in an evaluation of a 6-month-old child? What should a 6-month-old child be able to do? We've talked about it. It's all the motor, right? So they're born, they can't do anything. By 4 months, they're lifting their head. By 6 months, they're turning from their front to the back and the back to the front. And by 8 months, they're sitting. So if at 6 months, they can't hold their head up, which is their head will lag back. And what it is, if you take them on their back, hold their hands and pull it up, and their head hangs back, that's called a head lag. Usually the head will come up with the arms, and that would be a normal finding. How many hours should toddlers be able to stay dry for the nurse to suggest they're ready to begin bladder training? What do you think? You know, bowel training comes first, but then we start looking at bladder training.
Oh, just listen.
And the answer is just 2. 2 hours. If we see that there is a diaper that's dry for 2 hours, now we can start training them for their bladder training. How many minutes should a 5-year-old be in timeout?
So,
1 minute per year of life, so it's 5 minutes for a 5-year-old. For an 8-year-old, actually, it's 8 minutes if they're going to go in timeout. Very good. What type of family consists of 2 parents with children from previous relationships?
blended.
And that's called blended. Yes. And that's what I have. I've got 2 daughters with my husband, and I have a son and a daughter. So, and we've got lots of grandkids. Good thing. An infant who weighs 6 pounds, 12 ounces at birth should weigh what at 6 months? Well, what does their birth weight do at 6 months and at 1 year?
Doubles. Oops. 13.8
And
pounds.
that's about 13.8. Remember, at 6 months, they should double it. So 6 plus 6 is 12, pounds. And then 12 ounces and 12 ounces is another one. So 13 and a little. Perfect. 13.8. That's perfect. And at 1 year, it'd be tripled. Last question. What is an example of proximal distal development? Well, think about a baby and the way that they develop. What do they do first? What do they control first? And that's all about, their arms, and then they got their hands, and then they move a lot differently. So proximal distal. Let's see how we did here today. Ricardo, good job, Ricardo. Number 2. Whoop, whoop. Angie. Good job, Angie.
Thank
Good job.
you.
And number 1 is me. Yay, I did good. And then Kathia and Shirley. So that's your first class with me. Did you enjoy the way I teach, or what can I do
Yes.
differently for you?
Yes, I
Yes.
appreciate that.
Yeah.
And you said you had the cahoots too.
You're going to
That
have
was
the
cool.
Kahoot and everything every single week. If I can't
Good.
get to something, you still get them. Remember, next week is your first quiz. We do it at the beginning of class, and take that worksheet I gave you, fill it out, go over it. All your answers are there. I've gone over all of it in the lecture today. So go over, fill it out, and you all will do well on your quizzes too. Okay?
Okay.
Okay.
What
Right.
worksheet, Professor, where it says week 1 study guide or week 1
There you
1?
go. Week
Oh,
1
okay.
study guide. It's there. You
Oh,
all
okay.
have it. I made sure.
Gotcha.
And I'm going to repost it again because that's just what I do, trying to
Okay.
keep you all organized. It's been a pleasure. I appreciate questions. Angela, thank you so much. I like that your explanation of autonomy versus shame and doubt. I think that really drilled it home for everybody because that's actually the hardest one. What does that mean? So thank you so much.
This whole time, that's
Anything?
what I thought it meant, and I was so wrong. So
Yeah.
So
thank you,
anybody
Professor,
with
for clarifying.
accommodations, please send me your accommodation
Wash your hand
letters.
on code, please.
And if anything, just message me, okay? I'll
So
take
you'll
care
Okay.
of
be
you.
our teacher, Miss Betty?
Yes.
Okay, because it said